Good morning, Franklin Township. Welcome to the December 7th, 2021 edition of the Franklin Reporter and Advocate News Hour. I am Bill Bowman, the co-publisher and editor of the Franklin Reporter, and I am joined this morning, as usual, by
PJ Parker, Franklin Reporter and Advocate, co-publisher and advertising director. Good morning, Franklin.
We have a great program for you this morning. We are being joined once again by Dr.Perry Halkitis, who is the dean of the Rutgers University School of Public Health. We're going to be talking about what's new with COVID and the new variants and boosters and shots for kids and related topics and not only boosters in general, and also when you get a booster for the booster.
So that's a brand new topic.
That's a new topic. That's a brand new topic.
Started chatting about that.
Right. Before we begin, we must say that this news hour is brought to you by Nick and Robin White DeMeglio of the DeMeglio Home Team at Berkshire Hathaway, Fox and Roach Realtors. They're realtors with a heart. They treat every client like their only client and offer residential and commercial real estate services. You can reach Nick at 732-828-9403. That's 732-828-9403, or nicholas.com at att.net.
And that's NICOLAS.
That is correct. All right, without any further ado, let's bring on our guest.
Well, I have one more ado.
Oh, go ahead.
I want to remind Franklin that for 10 cents a day, you too can be part of the Franklin Reporter and Advocate subscription family. So go to franklinreporter.com and you can be walked through the process. Keep local journalism alive. It's news you want. It's news you need. It's in your backyard. franklinreporter.com.
Very good.
And now, without further ado,
let's bring on our guest, Dr. Halkitis.
Good morning.
Good morning, Dr. Halkitis. Thanks so much for coming on again.
Thank you for having me.
So much to talk about. Well, I guess we should start with the general question. As of today, as of December 7th, where are we with Omicron in New Jersey, if you can tell us?
Yeah, so Omicron, well, first of all, again, thank you for having me again and for having these open and honest conversations about this disease, this virus that continues to perplex all of us. Omicron is, very much in the United States, very much in New Jersey, very much all over our country. It is a variant that has manifested, that is over the course of the last few weeks. It is one of interest. It seems to be more highly transmissible. The question for everyone about Omicron right now is it as harmful as Delta in perpetuating disease and death? And, anecdotal data out of Europe and other parts of the world seem to indicate maybe not. But I think we'll know much better in 2 weeks. The point of all of this is that Omicron is out there, and what we do know about it more than anything else is that it's highly transmissible, and so that people who are not vaccinated, people who believe they have protection from because they had COVID-19 without a vaccination, are getting infected. That's where we are with Omicron.
You want to say that again?
Yes, I'm saying that people who are not vaccinated and people who believe that they have protection simply because they've had COVID and are not vaccinated are perhaps the most susceptible to Omicron and becoming infected with Omicron and its potential harmful effects. Again, we don't know. We don't know in the long run if it's as harmful in Delta and causing disease and death.
Well, now that addresses I guess you're saying that it's somewhat of a myth that once you've had COVID and or boosted and or vaccinated, however many times we're all getting vaccinated at this point, that we are now safe, protected, immune.
I'm saying that if you had
that's
COVID,
the concept.
And if you had, so let's do a parallel. I'm actually saying this, so just to clarify, if you've had COVID and you think you are protected and you haven't had vaccination, you are susceptible. Very similar. Here's my parallel to that. If you've had chickenpox as a child and you are over 50 and you don't get or even after over 40 for God's sakes, and you don't get the shingles vaccine, you are susceptible to getting shingles. So this notion that somehow you are protected because you've had COVID is false, false, false. And it's particularly false because with every variation, the antibodies that you had from Alpha, maybe at the beginning of the pandemic, may not be sufficient in fighting a variant that has 32 mutations in the spike protein. So the vaccinations and the reformulation of the vaccinations, which is happening in real time. Well, the pharmaceutical companies are changing the vaccines just like they change the flu vaccine every year, are going to be able to detect these changes in the spike protein and ultimately add the protection that your quote unquote natural immunity does not.
Gotcha. What does that mean to have 30 variations in the spike protein?
It means that the shape of it is different. It means that that the way that the antibodies work is that they attach to the top of the virus. Sorry for using my hands here.
That's okay.
I feel like I'm in organic chemistry all over again. And if it changes, just if you think about it, let me do a parallel here. I mean, imagine the virus is a circle, and imagine the antibody is a semicircle, and the semicircle can attach to it really well, right?
Mm-hmm.
But what if the virus changes and now it's a triangle? Right. And, the semicircle doesn't fit as well over the triangle as it does over a circle. And so that's the problem. It's like the identification of the virus and the ability to actually attack the virus is, altered because in some ways, I'm going to use this term, the virus had changed shape. It's disguised itself. It's, it's mutated. And that's what's going on right now. And, it's not because the virus is mutating because the virus is smart. The virus is just mutating because that's what happens to viruses every time you replicate. The parallel I have here for you guys on this one too, and I'll stop, I promise, is like, imagine you had a stamp, right? And you ink it, and then you stamp the envelope, and you stamp the envelope, and you stamp the envelope. If you don't continually ink it, at some point the stamp's going to be really faded. So that bad copy of the virus is like it's like a parallel to that stamping. It's going to be different than the really good copy of the virus, and it's going to be different and not as and not and a variant of what you intended it to be.
Okay, I just want to just inform our viewers and listeners, I guess, as well. As of December 7th, well, actually, as of December 6th, we have more than 7,400 township residents who have tested positive for COVID-19, including 60 just over the last weekend. That's the biggest, I want to call it a surge, but that's the biggest group of positive tests we've had in a very long time.
Right.
We have about 68,000 and change residents, regardless of what they say on the township website when they give out the daily coronavirus updates. They're using 2010 numbers. 2020 census, we have over 68,000 residents. So that's a solid 11% of Franklin Township residents who have tested positive since mid-March of 2020. And it's getting more. And as we know, it's going to be more. Thankfully, the deaths have remained low. We were at 215. 215 is too many, but I suppose it could be worse. And according to our Mayor Phil Kramer, who is, as you guys know, is a doctor and who is very, very proactive and is keeping on top of COVID in this township, and who does some calculations for us every now and then. I asked him last night what our transmission rate is, and the transmission rate is how apt the virus is to be transmitted from one person to another. Our transmission rate is right now 1.25, which is not good. You want under 1. Anything 1 and above means it's spreading. So we're at 1.25. And I think that's the highest it's been in a while as well. So that's where we are right now, Franklin. So Dr. Halkitis, that doesn't bode well for us.
Yeah.
Right? Yeah. So
it's an indication that it's, as you said, very, very, very clearly, it's an indication that the virus is spreading rapidly. It may be because the Omicron variant is out there. I actually think it's also because people have stopped mitigation strategies. They've stopped wearing masks. Look, if you're going out and it's holiday season and people are going to the big box stores and going to other places and shopping and not wearing masks, and so transmission is going to happen, and they're seeing their families, and so one of the things that I've been trying to really encourage, I mean, my own family, and then of course everyone in our school to think about is, of course vaccines are helpful, but they are not the single solution here, right? And and what we know is that, look, if you are in an environment that is potentially hazardous to your health, which is like you go, I don't know, to a Walmart or something, wear a mask if you really don't want to become infected. I mean, it's pretty simple. And I don't know. When I touch something that's harmful, like a chemical, I wash my hands. It's just very, very common sense here. And so the next month is going to be very telling for us. I think potentially problematic for us in terms of transmission. My hope is, as you said, Bill, is like we're not seeing the deaths, right? And we're not seeing the death because, one, our treatments have really advanced, and we know how to deal with this disease a lot better than we did in March of 2020.
Okay.
I think it's a matter of the virus having its own intelligence and seeking the most compatible host, thereby the unvaccinated. And the corollary to that is vaccination is not preventing people from being reinfected as well.
Correct.
So that's a paradox. What do you think?
No, I think you're absolutely right to say that. I think vaccination. Look, I'm vaccinated. I'm boosted. I still wear a mask. I'm not confident that with Omicron out there that, look, I don't want to get sick. I don't want to get the flu. I don't want any of those things, right? I don't want them, right? Why would I want that? Especially for like influenza is one thing. Like we know that potentially there's not really bad long-term effects of influenza, but I don't know anything about this virus, what's going to do to me in 10 or 20 years. And I don't want to know, right? So you're absolutely right, PJ. I mean, the vaccine is not 100% the answer, just like the vaccine is not 100% the answer for the flu. And there's other things you should be doing to protect your health, which is not going to work when you're sick, covering your mouth with a mask, washing your hands. Those very simple things we learned as children, how to protect our health, we need to do.
Right. Well, going back to our mayor, who's super, super conservative about this whole thing, he will not go to events where indoors. Even obviously he's been boosted and everything else, and he would double masks now, but he will not go to things indoors. In fact, I know that our official township meetings starting in January, because the governor's executive order expires on December 31st, are going to be held in, boy, that was a tortured sentence, are going to be held in person. And he was, I could tell at the last meeting when they were talking about it that he was not happy about that. I mean, I haven't spoken to him directly, but I could tell that he was not happy about that, that he would prefer that these meetings remain virtual, but they're bound to obey what the governor tells them, and the governor says it's okay to at this point it's okay to go back to in-person meetings. But I don't know how they're going to work that. I know on election night they had a limit on the number of people who could be in the council chamber where they were accepting and initially counting the ballots. They may do that again. I really don't know.
I mean, the point here, look, I'm with the mayor on this. I will not go to events that are not essential, right? If I don't have to be there, I don't have to be there. I will see my family on the holidays because I know that they're being safe and vaccinated. There's not a lot of us. But even if the number of people are limited in a room, it only takes is one infection.
Right.
Right. It doesn't matter. Like the wrong person in the room is the problem here, right?
Well, that's what our we have a state assemblyman, Joe Danielson, who's from Franklin Township, and that's what he discovered last year. He said, we were very careful. We washed our hands. We had the mask, on and on, the whole thing. One time he had an old friend over to the house. The one time they didn't wear masks. This fella didn't. He was asymptomatic at the time, but he had it and he spread it. And Joe's wife I think she was in the hospital, wasn't she, PJ?
Yeah, she was.
Yeah, she was very, very, very ill. And I think Joe got it a little bit, and it was not pleasant. It was very scary for them for a while. So you're right. Well, all it takes is one.
And the question I have, look, I mean, I know New Jersey's not New York City, but New York City is getting it right on this, right? Like you can't go into an indoor space unless you're vaccinated, right?
We're taking it a step further
with the private companies. Yeah.
Is mandating all private sector businesses. That's over 200,000 businesses in New York City as of December 27th. And well, that's interestingly I guess his swan song. Interesting that he's doing it right after Christmas, but right before New Year's Eve. Now, I'm not sure if the whole New Year's Eve ball dropping is going to be a live event again. But without that kind of protection being mandated, that is such a potential for a mega super spreader. That on the one hand, does anybody want their freedom restricted? No, of course not. But do we also want to be safe and protected?
Right.
So, I mean, that's another thing that I know our audience would like to be talking about is mandates. You see it coming in New Jersey?
I don't hate the word. First of all, I hate the word mandates. You know, let's change the language here and just call it
Let's make it woman dates.
Requirements. Requirements. You know, look, I think we want all of us. We all make an agreement that we want to be safe in our lives, right? So I've been in New York City to the movie theater twice in the last 3 weeks, right? I haven't been to the movies in forever. You know, and House of Gucci was what I just saw, which I don't know. We can talk about that. I don't know. We could talk about some other time about that. But
we'll do a movie review session with you.
Well, yeah, please. I mean, but I felt at least when the popcorn came, at least comfortable taking off my mask temporarily to eat my popcorn because I knew everybody in the movie theater, including the employees of the movie theater, were vaccinated. And so New Jersey, you want some sense of normalcy, you might have to think about this, right? Which is like, you want to go into an indoor space with other people who you don't want to make sick, you may have to prove your vaccination. And it was really interesting because not only did you have to show the vaccine card or the passport on your phone or where I had it, but you also had to show ID to make sure that you were not using somebody else's thing. So I felt really safe and really comfortable. And I think it was a minor request of me so that I can enjoy a movie without worrying that I was getting sick.
Right. I think that's happening in at least in some venues, like some large music venues are requiring proof of vaccine. There was over I guess it was September, there was the annual See Here Now festival in Asbury Park, which is primarily an outdoor festival. You know, they set up big stages on the beach and all these bands show up and tens of thousands of people come to this thing. They were requiring proof of vaccination or very recent proof of negative testing result. And you had to have a card or what is it called? Docket? The app on the phone? Docket. You had to have something to show.
New Jersey and Iowa. So
yeah,
if you are in New York, you're not going to be able to do that.
I can't find my vaccination card, but thank goodness I have Docket. We have a question, and this is something that has been talked about in the past by a guy named Tony Bartone. How long can the virus live on hard surfaces? Can it be transmitted that way? I am a custodian and clean after the kids are gone home. I worry about picking up the virus as I clean.
Hey, Tony, good question. No, not really on the surfaces, right? That was early on. We were worried about that. Look, it's good. It's good hygiene. It's good philosophy to clean surfaces anyway, because there's other pathogens except for COVID-19 on those surfaces. Bacteria, like when you cook chicken on your countertops, you should be cleaning them off. There's salmonella there. It's like just very, very simple things. That's just good housekeeping. But no, I would not worry about COVID-19 being transmitted. This is an airborne virus, which gets to to Bill's point, which is outdoor venues. Yeah, sure, they're fine, but not when everybody's standing next to each other and coughing on each other. That doesn't solve the problem.
We've had a few outdoor things in Franklin over the past few months, but PJ, I can't remember.
Past weekend,
people were masked. Yeah,
at concert.
Right. People were masked. People were not masked. And no one was going around telling people to put their masks on. Did I see a chart correctly? Is Omicron in New Jersey?
Omicron, I believe, it's definitely in New York. I think it's in New Jersey also. I haven't looked at the latest data. Look, the data are really. This is what I also want to say to the viewers. Remember, these data are delayed. Right. So we're 2 weeks back at this point, right? So it's very, 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 very when they were like, oh, it's just in South Africa.
Yeah,
I was like, no, it's here. And to PJ's point about New Year's, it's like the same thing. It's like, do you want to be in a situation on New Year's Eve if there's an outdoor event where we can control what happens in Franklin, we can control what happens in New Jersey, we can control what happens in the United States more or less. Do we control what happens in Italy or in Greece
Right.
or in
Mhm.
China? And those are the people who are at that event on New Year's Eve.
Right.
Mm-hmm. No, there are a few New Yorkers who will attend that.
Not
I.
No, I'm very happy on my big TV watching it.
Yes,
Sure.
I know. I did it a few times.
I
In
did it
college.
once in the
Oh my God, it
very
was-
early
It
'80s,
was
and
a lifetime experience.
yeah,
But
that
right
was
now,
one time
even
was
if
enough.
I lived in the city, and that's a stellar event. People are kind. People are joyful. You want to be in that kind of an environment
Yeah.
when there's so much hostility out there, but not now. Not now.
Not now.
I don't get it. I don't get it. That
Right.
even if it's going to be held, which I apologize, I don't know definitively.
I don't know either. And
It's just inviting. Issue.
Right. Here's the thing. Here's where we are, and let's just like play it out and just say what's going to happen. This thing's endemic now. It's not going away. It's not going away.
Right.
And so the question I have, and I asked PJ and Bill this question before, like I was boosted at the end of August, early September. That's like 6 months ago. Do I need another booster now? The data's not out there yet.
Exactly.
Maybe I do. I don't know. And so I have a question out to my colleagues who are doing the research and to my doctor, and nobody seems to be able to give me an answer to this quite yet. And I don't know. So what my solution is, I'm going to go have an antibody test tomorrow to see what my levels are, in order to see that I have see levels of antibodies.
That's a good idea.
That's
yeah.
at least I can control myself that way.
At
But
least
look,
you can-
but again, even when I say that, look at me. Like I'm this like guy who's a dean, who has a lot of privilege, who can do these things. Most people don't have these access to these things, right? So we just have to do the right things for each other and protect each other.
How are things at Rutgers?
Good. They're good, actually. Yeah. I mean, remember, the university was like, excuse me, was the first university out with requiring students to be vaccinated. And, and then, when Biden and the administration said that public organizations with public funds had to be vaccinated, like we're like near 100% in all populations. I mean, there are, of course, people who have waivers because of religious reasons or because of very real medical reasons. But things are really good there because in our little bubble, right, things are fine. Who knows what's going to happen in January when people go home?
Right.
I don't know. Right.
Yeah.
Well, no, you introduce a potentially thorny subject. I support medical exemptions. I mean, you certainly don't want to do something on the one hand that's supposed to be self-protective and preventive, but on the other hand, you don't want to compromise your health. But that person who has claimed an exemption is still able to transmit, is still able to be asymptomatic, is still able to be symptomatic, and at some point still get COVID. How do we cope with that?
Yeah, it's tough, that, right? And I have a story about that. My brother lives with progressive MS, right? And he, he's doing relatively well with his infusions and stuff. Like he's managed to sort of keep it under control. That's great. He got Janssen, when he was available, and I kept his name is Tony, and I was like, I would talk to him ever since September, saying, "You got to boost up, man. You got to boost up. You got to boost up with some mRNA here, right?" And my brother's my brother. He just listens to me but doesn't listen to me. And eventually, and he's my younger brother. It's like this weird relationship. And then fast forward, I spoke to him 2 weeks ago, and I said, "Have you gotten your booster yet?" And he said, "Oh no, I've had my infusion now, and for his MS, and I can't have the booster until 2 months elapsed." So here's a medical condition that's legit, but come on. I wish, he had thought about this earlier, right? So I get it, PJ. It's problematic. He could have been a little more proactive in getting his booster and then getting his infusion. But you're right. Those people can absolutely transmit. And so I said to him, should we see each other at Christmas? I'm concerned, less for me, more for you.
Sure.
And we've negotiated that we're going to be at my aunt's house, and there's going to be very few of us, but it's still a worry for me.
Yeah.
Well, here's the adjunct to that: religious exemption, where there is no medical stipulation that could pose danger to the individual. It's a moral issue, and I'm not arguing it, but there is an issue.
Yeah, I think it has to do on the religious exemption thing. I think it has to do with the early days of the precursor to the current vaccination. I think they use stem cells, to develop,
other vaccines,
like 95 or so, that and those things that have, the research for the mRNA vaccines that we're using now was based on that early work with other vaccines. So which is why I understand, which is why they were able to get a vaccine for this so quickly. Based on proven research. And when people say, "Oh, I'm not getting this vaccine because it's too new," well, no, it's really not. The basics, the foundation for the vaccine's been around for a long time. They just were able to very quickly adapt it to what they needed it to be for COVID-19. But I think the religious objections are to the use of stem cells.
And I would argue about, look, I would, that's absolutely right. And I would just suggest the following, which is, first of all, I find it amazing that my tradition that I was raised in, which is Eastern Orthodox, Greek Orthodox, the Archbishop of the Americas came out and said, there's no such thing as religious exemption. I was like, wow. We've entered the 21st century here, Greek Orthodox Church. Holy smokes. And he's actually this very, very progressive guy. But the thing about stem cells is, like, and this is the battle that you guys are hearing about in all sorts of, issues, including, the fight in Mississippi right now with the Supreme Court, is like, okay, yeah, stem cells from babies, fetuses, potentially, somebody not getting vaccinated, making somebody else sick and dying. Like, which life matters more, right? And so it's like, I don't know. I think, like, I don't know. That's a decision everybody has to make on their own. So yeah.
Well, that's
another show.
That's another show. Which
movie reviews with the movie reviews, right? At the same time.
And then we'll do a gourmet food one with you. I have a brother's story too. He's going to kill me for talking about it, but we almost lost him. This first week he had COVID. He was told to get his affairs in order, and he was not a good patient until his doctor frightened him. He was walking out the door saying, I can take this oxygen home and I can do this myself. And the doctor said to him, okay, you're free to go. If you can get out of this bed, walk to the door, and then walk to your car without any assistance, and your oxygen levels remain high, okay, I'm going to disconnect you now. They dropped immediately to the 70 level. And the doctor then proceeded to say, however, you do that, you're going to be dead before you get home. All of a sudden, my brother became a model patient. Nonetheless, I say this because he is still not going to get a vaccine. And his logic is that his cure was remdesivir and monoclonal antibodies, as well as being in a prone position for a solid 21 days. And there is a clinic that is going to be opening about 20 minutes from his home. And he's on the West Coast in California. That is a monoclonal antibody clinic. Because, okay, if I get COVID, I'll just pop over there and get a shot of monoclonal antibodies. There's got to be more to that. It can't be that simple.
Well, it's proactive versus reactive, right? It's like, nobody, how about you don't get syphilis instead of being treated for syphilis, right? It's like,
I love it.
I mean, how about that? It's also more expensive for the healthcare industry. Why do we have all these rocketing healthcare costs? Because people aren't doing prevention, because they're doing treatment,
exactly.
Right? Treatment is more expensive. And it's just, I'm sure you love your brother. Very responsible. It's just like, get the freaking vaccine.
And it's also very selfish, because he doesn't have to do that. He could get vaccinated, and he doesn't have to take a treatment that someone else may need just because he doesn't want to get. Is it? Yeah. Well, that's not.
What I'm asking, I'm not debating the moral issue here. What I'm asking is he correct?
No. I mean, he's correct in the sense that he will have some kind of immunity from having had COVID. We don't know if his immunity will be effective against all variants of COVID. And quite frankly, we don't know if monoclonal antibodies will work against the new variants of COVID if he gets it again, because the monoclonal antibodies will develop on Alpha, not on Delta and Omicron.
Okay.
Right? So
thank you.
He's wrong.
Thank you for the clarifying.
Right.
All right. But that's important, because I've been hearing it from others as well, that we have a treatment in place, folks. We don't need to get the vaccine if we don't want to get the vaccine. And people are objecting on a health basis, that there's still, although it was in development for a long time, there's still some question as to long range effects. We don't know. We don't know. We're trying to be proactive now to halt spread.
Right.
Yeah. I just want to give a sub layer to the 7,400 and change Franklin residents who have tested positive. To look at the schools. The school every week. The school district puts out an update of faculty and staff and students who have tested positive. As of December 3rd, in our school district, we have a total of 102 cases. That's 68 students, 31 staff, and 3 vendors. And it looks like Claremont Elementary School has the most cases right now at 19.
Not surprising.
Right, with 17 at one of the middle school campuses, and 15 at the high school, and that number has been steadily increasing since kids went back to school. Even though they got to wear masks, that's a situation where they've got to wear masks. We were just in the high school yesterday for something, and you can walk in there, you've got to wear a mask, even though it wasn't during school hours. You're in that school building, you have to put a mask on.
Exactly.
Right.
And that is throughout the school system.
Yeah.
Right. You walk in any of those buildings, you must wear a mask.
Yeah.
But you want like so here's what I think is really important here, and I use this parallel all the time in my work around HIV, which is that people who are living with HIV get treatments that attack the virus in 3 fronts, right? In 3 different places on the replication system of the virus, right? And they get their virus completely under control, right?
Mm-hmm.
When we were using monotherapies in the early 90s, it wasn't working, right? Because it wasn't as effective. Now you're attacking in 3 spots. Look, I think it's the same thing here. You need vaccines and masks, and you need distancing. You need all 3 things together. Mm-hmm. The problem we have with kids right now, 5 to 11, is that only 15% are vaccinated in this country. That's nothing.
What is that percentage?
15.
15% nationwide.
Mm-hmm. Correct. 51% of 12 to 17. That's better. Have 51% of 12 to 17 have full vaccination. 60% have at least 1 vaccine. So that's better, but it's also been available. The kids, the little kids, the 5 to 11s, who touch their faces and pick their noses, they're the bigger problem, right? And so I say to parents this, if parents are listening, why would you want your child exposed to a disease that we don't know what the disease is, when we don't know what this disease is going to do to your child in the long run? We know the vaccines have been tested. They're relatively safe. Yes, there's some case of pericarditis and myocarditis. They are minuscule in proportion to the number of vaccines that have been given. So when you do that decisional balance, consider what you're doing to your child's health in the long run if you don't vaccinate your child.
Mm-hmm. Well, it's the balance. Balance is the operative word.
Mm-hmm.
Right. And I believe, I don't know what the percentages of kids in Franklin who've been vaccinated, but I know that there has been at least 1 vaccine clinic given for school kids since the school's been in session this year.
I think it will become.
Again, I'm sorry.
Go ahead, PJ. Go ahead.
No, I was going to say, bouncing back to the concept of mandating. Do you see that
requiring
as coming in the school system?
Yeah, when children are vaccinated, need to be vaccinated to go to school for other diseases. Adults need to be vaccinated when they go to college for diseases. I remember going back and getting my MPH. I had to prove all my vaccinations. Mm-hmm. Once emergency authorization is gone and these are fully approved, I imagine that they're going to be on the list of required vaccines for children to go to school. Yes.
Well, not just children.
And adults,
administration.
I mean, I think
staff.
Yeah, because it makes no sense, right? It makes no sense. It was one of the issues I had with at Rutgers, but we've resolved it because most people are vaccinated. It was like we were requiring students, but not requiring faculty and staff. I'm like, duh, what's that? How did that work?
Exactly.
So
all the children are vaccinated, but the teacher is not vaccinated.
That's ridiculous.
I think people are. It's politics. You know that.
Was that an AAUP thing? Were they objecting?
Yeah, it was negotiated with the union eventually, but at some point you have to say, like, you gotta stop putting these political aspirations ahead of the health of people. I mean, that's what's sort of like defeating us here. But that's just me, the academic speaking. Well,
we talk about rights, and we hear a lot of parents are wary. I mean, this is a relatively new vaccine for their children. They're wary, and of course, as parents, understood.
They're not getting life
But
polio.
they're getting, you get onto this political bandwagon of my right
I
to
know.
decide what is best for my child. However, that posture really tramples on my rights and my child's rights.
Correct.
Mhm.
Your decision to resist protection could impact me and my child negatively.
Correct.
How do we balance that? I mean, everybody's right and everybody's wrong.
Well, I just think, I mean, I've said this from the beginning, and PJ, you're exactly right. You have a right not to be vaccinated. I have a right not to get sick.
Right.
Okay. So you know what? Stay home if you're not vaccinated. So I go back to this. You don't want to be vaccinated. You don't get to go to certain places. Very simple. It's very, very simple. And it's like, that's the choice, folks. No Taylor Swift concert for you. If you're not vaccinated.
Right. And that was a big issue in school board races across the country, and even here in Franklin, that whole issue of parents taking back as if they gave it up. But in their language, parents taking back the education and the, I guess, welfare of their kids from these autocratic, and I put that in quotes,
right,
school board people. And in other parts of the country, I guess they were successful. They were not successful here in Franklin. I don't, I'm not going to say anything about that, but whatever the district has done, I think has worked. And I think they're doing their best to kids are social animals, right?
Right.
And they're doing their best to keep them apart and to keep them safe, and there's really not much more you can ask.
That's all we want. We want the school. Look, I want my child to go to school and be safe.
Right.
And that means that there's not going to be a person in there coming with a gun.
With a gun, right.
Right. It means it's not going to be like some crazy teacher like abusing that child. And it means that I'm not going to have my child get sick from COVID.
Right.
So I think it's not those things are not different from each other at all.
Mm-hmm.
So what do we have to look, and I say look forward to facetiously, what do you think we have to look forward to with COVID in the coming months?
We're going to see a surge next month. We're going to see a surge on the holidays. We're seeing it right now. It's beginning. Hopefully, we're not going to see the deaths. I don't think we will see the deaths or the hospitalization, but we will see a disease that's with us for 4, 5, 6, 7 years. So it's not going anywhere. What I foresee is, the question I asked, a while ago, how often do I need to be boosted? Do I need an annual vaccination? Those are that's where we are at this point. That's the next stage. Yeah.
Right.
So, I mean, it may not.
I'm sorry.
Yeah, I was going to say, excuse me, it may not result in a lot more deaths, but what about the long hauls, right? What about the long haulers? I mean, there are residual effects of this disease, right? So people say, oh, it only it doesn't kill that many people. Well, no, but you're going to have a lot. I don't know. Are there any statistics on long haulers?
People.
There's there are cases of long haulers is like a fascinating thing, right? Because it's also we have to decide how we define long haulers. So I'll tell you the story. My friend Nancy Eisenberg, who's a school teacher in New York City, who was vaccinated, whose husband died, her ex-husband died of COVID. Anyway, but she was vaccinated. Really careful. They went back to New York City schools. It was a mess because those buildings are just disastrous.
Sure.
And she got sick, and I think to this day, this was like in September, still doesn't ever taste that. So is she a long hauler? Maybe she is a long hauler as a result of that. So I think there's going to be a subset of people who it's going to manifest that way. I think other people, they're going to see complications that we haven't even begun to see.
Mm-hmm.
Right? I don't have any idea. That's why I think the vaccine is critical to stop getting people from being reinfected, even if they are vaccinated.
Yeah. Did you go to the Thanksgiving Day parade?
No, I don't like those balloons scare me. They do. I watched it. No, I was actually a hunkered down at my house. We were alone. We just watched it on TV. I mean, I was happy to watch the parade and see Santa coming, but
Okay,
no.
but were you concerned by the crowd? I didn't see a whole lot.
I mean, they were all packed in front of Macy's. It was
packed,
I didn't see a whole lot of masks in that crowd.
No, I mean, I'm sure they checked them for vaccines. I'm pretty sure they did. I mean, it is, it is Macy's and it's New York City, but that's no guarantee. It's interesting. I haven't heard any fallout from the parade, but it was crowded. It was really, really crowded. And who stops
scary.
anybody from going on the street and watching it, right?
Right.
Yeah. I'd like to just bounce back for a minute to boostering and boosters and what's actually a booster. I had a couple of friends who called me and said, I went for my booster, and you really have to ask for either the booster or the third shot. Allegedly, now we're using the umbrella term booster, but there is a booster, which is 100% of the dosage. And I'm sorry, it's 50% of the dosage. And then what's called the third shot is the 100% of the dosage.
Correct.
What's the difference? What should we be asking for?
It's the level. It's a level.
And then that also morphs into your question of, do we have to get boosted after we get boosted? I mean, this could be ad infinitum.
Yeah, so we don't. So it's all changing. Like it's again, how many? We're 21 months into this, right? We're like we know a lot more than we did 21 months ago. So when I went in the end of August, early September, I got the full dosage, right? Because we weren't.
But did you know it was the full dosage?
I did, because at that point the studies hadn't come out that had said that you don't need as much of a dosage. The recalculation happened after the studies had come out, and they said, you don't need the full. This is the full on dosage. You need 50% of the dosage. So I'm actually happy I got a little extra mRNA while I was at it in August. But now the recommendation, now what they're giving is the reduced dosage, because they don't want. There's evidence that it's just as effective. It's a safety issue. It's what's resulted from the studies to show that protection. But my question becomes, and maybe it's this, PJ, maybe it's because we know that people are going to have to go back regularly. So why give them the full dosage if they're going to have to go back regularly? The problem I have with all of this is the problem I have when anytime you introduce new behaviors in people. The more you ask people to do things, right?
The more resistance.
Don't smoke cigarettes every day.
Right.
Go to the gym 5 days a week.
Right.
The more you add things to do, they're not going to do it.
Right.
So I wish we had a booster that would last a while, but we don't have that. We don't know that yet. So
is this efficacy right across the board in terms of the dosage? As far as is there a difference in the 50% dosage from Pfizer versus the 50% dosage from Moderna? And where does the Janssen J&J shot fit into that? I mean,
they're all variably different. They all vary, right? But they all have not exactly the same level of protection. They've all been titrated to the amounts that they've tested out. Again, I come back to my question, PJ, which is like, do I need a boost? I got full 100% Moderna shot 3 on, I think, August 29th, August 3rd. I don't remember. Do I need another one right now? I don't know. I don't know the answer to that question. I don't know.
So with the flu shot, there's a set flu season, right?
Yes.
Okay. Is there a COVID season, or is that like a year-round thing?
No, I mean, it's likely to be parallel the flu season, because it's when people are indoors, when they're interacting with each other, it's going to parallel that. So it makes my crystal ball on all of this, which I think I've told you guys when we spoke last time, was I think like every fall we're looking at two injections, or maybe some formulation that includes both of them, flu and COVID. That's probably when we're most susceptible. When we're outside, when we're like at the beach, when we're like, yes, there's still some danger, but really it's when we're inside that the problem really begins.
Right.
I have one more question. There was some talk about a combination booster that was effective for COVID, for flu. I think we didn't include pneumonia in that because that's a longer range process in the actual administration of it. But is that any closer to becoming true? I
mean, I think this is going to be. I actually do think that's what's going to be at some point. Some combination. You want people not to have to go back twice. Right. Ideally, you'd either give them both injections once, or you'd have the combo. Look, it's like I go back to my HIV stuff, because this is what I know really well. You ask people to take 9 pills a day versus 1 pill a day. 1 pill a day is not going to work. It's going to work a lot better for people taking it regularly. It's the same idea here. It's going to get there. The technology is moving really, really fast in that direction. I think the question for me now today is really when, how often. do we need to do this? And I hope it's just annually that we need to do it. I think it likely will be annually.
Okay. So vaccinations, boosters, masking, keeping your distance. Did we talk about hand washing? Is that a big priority still?
It's good hygiene. I mean, it's just good. Yeah, I mean, I do. I mean, I have my hand sanitizer. I mean, my hands are really dry and chapped because of all this, but I keep it around. Like, look, even though I know, so like at the gym, for example, I have my phone at the gym. I listen to my music, right? I'm going to the gym, right? Because the gym I go to, everyone has to be vaccinated to go to. Okay, fine. So I'm good. They still have that little ultraviolet thing as you leave to put your phone in to get zapped to get all diseases, right? It's Equinox. Gotta love the Equinox people. I know there's no COVID on it, but it doesn't mean that there aren't other diseases on my phone that I've put down all over the place. So I zap it every time. So I've changed my habits just generally, even though it's not necessarily COVID specific. These are just good habits to do. So next few months, masking, continue to distance. Do not go to please, no holiday parties, people. Please stop. No holiday parties. And just let's get through it and get to the new year and see where we are at that point.
Yeah. I think people have pretty well accepted the mask thing.
I like it. I like it in the winter. It keeps
social
me warm.
Distancing. That's gone.
No, and you know what? I hate to do this, but we're going to see STI rates through the roof too over the next year.
Really?
I think so. I think after people have been pent up, STI rates have been rising in this country for years. I think it is a huge surge now. We've opened the floodgates and people are like, I haven't seen another human being my whole life. I don't know. Maybe the 15 COVID pounds will prevent that from happening. I don't know. I don't know.
That's why I'm going to the gym now too. Get rid of the COVID punch.
I mean, the gyms. I think that kind of stuff is really important for people, for the viewers to also think about too. Is you got to take care of the meditation, the gym, whatever it is that you're doing, exercise, you're walking the park. It's so crucial to get through this insanity that we're living through.
Yeah.
Because you don't know the stress. You don't know on an every minute basis as you're watching the news or you're having these conversations what that stress is doing to your body. And so taking care of yourself to breathe and to exercise, really key.
All right.
What do you think about supplementation to build the immune system?
I am a firm believer in vitamins and supplements. I do them. I don't know if I have the most expensive urine in the whole world, but I like them. I know I feel better. I mean, I'm also a huge fan of probiotics. I think probiotics are extremely helpful just because of the amount of antibiotics we've all been put into our system over the course of our lives as children, and our guts, especially for people our age. I'm sorry, you guys. Especially for our age, as we get older, that metabolism really changes. I'm a huge fan. I'm a huge fan of that. And though the data is all over the map.
Yeah, there's for a while, and I'm still looking for a source. I was getting vitamin C intravenous drips every other week.
Oh.
And my source location, their nurse practitioner had to relocate. And so they have not replaced her.
Oh.
So I'm still in the process of looking for an alternative source. But I know I felt better. And I felt emotionally better because vitamin C is a tremendous antioxidant. And there have been countless studies that it's not only preventive, but it has been curative with COVID. The direct infusion of vitamin C. So, I mean, anything that's going to build the immune system, that's ground zero.
Right.
Let's start out with as much health as we can to fight this.
I think, and that, PJ, is exactly the point. And I remember my doctor when I got COVID, and by the way, folks, I did have COVID in March of 2020. I had a mild case, but I got vaccinated. Right. Hello.
You got vaccinated before you got it?
No. Okay. Because when I got sick in March of 2020, I didn't even know I had COVID because I wasn't that sick that they would test me. The only reason I knew that I actually had it was in May I had an antibody test. And I was like, of course I had COVID. And I spoke to my doctor throughout the period when I was not feeling well, and he said exactly what you said, PJ, which is large amounts of vitamin C. You got to be doing vitamin C. You got to be doing vitamin C. Right. So I believe in that. I believe in turmeric. I think that's really, really important, as an anti-inflammatory. And I do believe in
vitamin D.
And vitamin D and vitamin B. These are really, really important things. I think so. My point to all of this is that the people who are going to remain healthy and fight COVID potentially in a really effective way are taking care of their bodies anyway. through exercise and meditation and vitamins and eating well. The people who are not taking care of their bodies. So they're adding damage into a damaged system, and they're going to be more susceptible to death. And on that happy note,
yes, thank you. So I know you've extended your time.
I loved every minute of talking to you guys. I'll come back anytime you want me. I appreciate it.
You're wonderful. You're a tremendous resource, and we're so grateful that you're on top of this.
I get so proud when I see you on on television on the networks, and I say, yeah, we had that guy.
Oh, thank you. I love doing. I think my job in life, part of my job in life is to make sure that, I do good research, but really that I speak just to people. Right, public health is about people, right, and making sure we're having an open and honest conversation without judgment. So, Happy New Year's, you guys!
Thank you.
Don't go to Times Square.
Not gonna.
No.
All right.
I'll tune in on local network.
I'll try to stay awake.
Maybe
to tune in.
Yeah, that too. That's the biggest challenge at this point. Dr. Perry Halkitis, thank you so much. Again, folks, this has been Dr. Perry Halkitis. I'm going to keep saying it that way because I was informed yesterday that I've been mispronouncing his name every time we had him on. I feel so bad. Halkitis.
Thank you.
The Dean of the Rutgers School of Public Health. Thank you so much for being on, and we will see you again. And be healthy.
Yes.
You too. Bye, guys.
Bye.
All right. Well, that was very. He's always very interesting.
He's just so on top of so many of the issues.
Yeah.
And I think it's really social distancing. That's been the one facet of this that nobody is observing. I mean, people are aware and conscience driven as far as the vaccines are concerned.
Yeah.
That's certainly everybody's awareness. Masking is still happening to a great degree. Nobody is standing 6 feet apart from anybody. The lines in the supermarkets where there were arrows going, you can go up this and
gone.
down this one.
Yeah.
And you must stay 6 feet apart before you approach a register to check out. That's gone.
Well, those one-way aisles were kind of ridiculous anyway, because even store employees were ignoring it. So
that doesn't mean it was ridiculous. It means that it was ignored, but it was there for a reason and it made sense.
Nah, I don't know. You had to walk all the way up to the one to get something. If you were in the wrong way on the aisle, you had to go all the way up to and then go all the way down to get to the thing. Oh my God!
Feet of exercise.
They had to walk for Pete's sake. Not all stores did that.
Back to the social distancing. I think we have got to develop more of a consciousness about that, because you don't need to be in somebody's face just because let's say you have been vaccinated, you're wearing a mask. It's not foolproof. There are breakthrough cases. Unless you're wearing 10 layers of masking, there's still the possibility that something's going to get through that mask. Just be proactive, be preventive. Let's get back to social distancing. Now, we hope that during all these holiday events, it's kind of hoping against hope, people are going to congregate with their families and friends and hope that everybody is safe. So it's a little bit more difficult to enforce. Excuse me. A little froggy in residence. It's harder to enforce when you're in a familiar situation and you feel like you're safe. You feel everyone is vaccinated. But there's the but. Let's just be proactive. Let's just be preventive and do what we got to do.
And people for the most part aren't going to do that. I mean, we're seeing the surge now from Thanksgiving. That's what these numbers are telling us, that people were not safe when they got together for Thanksgiving.
Not just Thanksgiving. I mean, there are school trips that are happening. There are events that people are.
I don't know that there are school
allowing
trips
their children to go on bus trips and events, and
I don't
kids
know
are getting sick.
I don't know that's happening. I don't know that doing bus trips.
There are a few occasions. Yeah, I know of one school system where that absolutely happened. Well, where a school trip
Franklin.
did happen, and as a result, school was shut down. I think they're scheduled to reopen, but it went immediately. Very proactive of that superintendent. Immediately went to remote learning.
Yeah.
I mean, there was just no question that was the prudent thing to do.
My reference is Franklin Township, so I don't.
Oh, well, you know what? Our reference is wherever this virus is. just because we're in Franklin Township and we drift over into Middlesex County, that COVID is not waiting to pounce. That's a little cavalier. Nonetheless, the bottom line is just let's be safe. Let's do what's good, not only for ourselves, but for our friends, for our family, for our colleagues, for our community. So it means wash our hands. We're back to that. When we started continuing our live stream broadcasts during the initial stages of the COVID phenomena, we always ask you to please wash your hands, use your sanitizers, be safe, wear your masks, and social distance. So let's go back to that, because these variants are not going away. And we had a little pre-session with Dr. Halkitis, because the variants seem to be named after the Greek alphabet. Well, after Omicron, there's maybe only 10 letters left in the Greek alphabet. When we get to Omega, then what are we going to call them? And he said they're going to start being named after galaxies and stars. So I guess we're going to see Pluto and Venus, and who knows what it's going to be called. But the point is, there's an endless supply of variant. The nature of virus is to vary, and it seeks the most vulnerable host. So there's a whole lot of common sense that can be applied to this situation, and I hope we will.
Well, we'll get through it. We'll have and I said this many times before, the anti-mask movement in this endemic now, I guess it is nothing new. During the flu pandemic of 1917, 1918, there was a very, very strong anti-mask movement. They were called mask slackers, and they got violent. And there were riots. There were people who were arrested. They were thrown in jail. And and you saw signs back then, people wearing signs saying, "Wear a mask or go to jail." And they weren't joking. And people did go to jail. So, people decry the what's going on today, and what are these people doing? Why are they so intransigent about this? Well, there's a big history of people not, when seatbelts were becoming, when the federal government mandated seatbelts in cars, they were the same thing. You're not taking away my freedom to go through the windshield in a head-on collision. And
we've had a very concrete example of mask resistance just recently in Franklin, in one of our.
Oh yeah, at our school board. Yeah, exactly. Yeah. So there you have it. Yeah. Anyway.
And that was it was not pleasant.
No, not pleasant. Not pleasant at all. All right. Well, that was good. And before we leave, we must remind you folks, and pleasantly so, and that this news hour was brought to you by Nick and Robin White DeMeglio of the DeMeglio Home Team at Berkshire Hathaway Fox and Roach Realtors, the realtors with a heart. They treat every client like their only client and offer residential and commercial real estate services. You can reach Nick at 732-828-9403. That's 732-828-9403. Or Nicholas.com. That's Nicolas.com at att.net. And
we could also remind you, Franklin, that if you would like to sponsor one of our Franklin Reporter and Advocate News Hours, please contact me at 732-820-0840 or ads at franklinreporter.com. We got a lot of response from these news hours. We try to make them as informative and as current as possible. On that note, if you want to explore a topic, if there's something that you would like us to investigate and bring to you via this news hour, please also, you may contact me at the above information, as well as Bill, which is editor at franklinreporter.com. Just for your community contribution. We're more than happy, and we welcome your suggestions. But again, if you want to publicize your business, just let us know. We're open to having your sponsorships. We will promote it in our Facebook advertising, as well as the beginning of every news hour, as well as the close of every news hour. So you have 3 separate opportunities to take advantage of our breadth of coverage. Also, any of our live streams. Now, we had a very interesting one last night as far as the Franklin High School football coach decision, which is coming up. A lot of concerned parents, a lot of concerned teachers, players. It was quite an event. You may go to the Franklin Reporter and Advocate Facebook page to get some information about that, as well as the story at franklinreporter.com. But you have the opportunity to be a part of our live streams as well. We get a lot of viewership on that as well, and your advertising can benefit from that exposure.
Absolutely. Also, the editor of franklinreporter.com, if you have any ideas for stories or tips on stories that you want to pass on, that's where you do it. We're also on Twitter. Obviously, we're on Facebook, and we are also on the Insta. We are also kind of on TikTok.
Oh, God. You know what, Franklin? I would love your feedback.
I'm trying. I
would
don't know.
love your feedback about TikTok. I am open to commentary.
I mean, it's a viable.
That's all I'm going to say.
I mean, it's, I told you about the
statistic. Be a tool, but I think it also can be.
Well, yeah, there's a lot of nonsense. Of course, there's a lot of nonsense on it. There's also a whole lot of really very, very funny stuff. People are incredibly funny in this world. And there's a lot of that stuff out there, and there's a lot of nonsense out there. But
there's a lot of danger as well.
52%
of children who are being influenced on a level that they should not be being influenced when they're young.
Yeah, that's true.
And impressionable.
You know what they said that about
fit in. I mean, that's a whole nother.
People say that about television too. So
yeah, okay.
52% of people aged 18 to 29 get their news from TikTok, and
well then.
Major news outlets like the Washington Post, like CBS News, even local television news stations throughout the country are turning to TikTok to reach those folks. And some of them are doing, like the Washington Post has a guy dedicated to TikTok. That's what he does. And he gets dressed up in all these ridiculous costumes and he brings the headlines to people. And it's funny,
so
it's informative. Look forward
to the editor of the Franklin Reporter.
No, you're not going to see me. Costumes? No, you're not going to see me in a penguin suit anytime soon. But no, I do my best.
Right now, reindeer antlers.
Yeah, not even that. No, it ain't happening. Because the internet never goes away. Already I know there's a video out there, because I know who took it, of me making funny noises trying to dissuade some wild turkeys from attacking me. And it looks really ridiculous. And this is in Franklin, by the way.
Where is that video?
You have to ask the mayor. You have to ask the mayor. I know it's out there, and I know any minute, any day now, that's going to show up somewhere.
Well, you've been warned, Franklin.
I'll deal with it if and when it happens. But unless he deleted the video, I don't know. But yeah, I was just trying to get those stinking things away from me.
Oh gosh, that's funny.
Because they are very aggressive. But anyway, I'm trying the TikTok thing. We're on, you can go to TikTok and I guess search. I really don't know that much about TikTok yet. But I'm doing my best, and I'm going to be more active on it. We have other plans. We want to revitalize our podcast. The new year is coming, so we have plans for things with a newspaper. We want to revitalize our podcast. I'm not quite sure yet what avenue that's taking, but basically we're trying to give you a land, sea, and air approach to bringing Franklin Township's news to you.
I can't wait to hear about the sea part.
Metaphorically speaking. How about belt and suspenders approach? How about that? How's that better?
Okay. Well, I'm getting a notation that my battery is
all right. That's a good way. We're about an hour, so that's good. All right, Franklin. Thank you so much for tuning in, whether you tuned in live or you're watching this from the comfort of your couch later on in the day or on the weekend or whenever you're watching. We appreciate you watching, as do our sponsors. And please patronize our sponsors. This is one last plug. Whether it's for the news hour, the live streams, the website, or the newsletter, or the newspaper, please patronize our advertisers. Let them know that you appreciate them sponsoring and supporting local news in Franklin Township, because if local news goes away, not good things happen, and that's been proven. So that's all I'm going to say about that. So Franklin, until we meet again, as usual, stay safe. PJ, say that thing that you say.
I'm going to say, Franklin, stay tuned, because we're going to be touring Franklin to get pictures of holiday lighting.
Yeah.
But until then, we'll be back.